CBS News medical contributor Dr. Celine Gounder is editor-at-large for public health at KFF Health and joins us to sort this all out for us. So, hello.
Good morning.
So it says for kids under 4 that you should separate them, the MMR and the chickenpox. What do you think about that? Does this make sense to you?
Well, the CDC had already been recommending for kids under 4 to split them up. Typically, kids will get their first dose at 12 to 15 months, their second dose at 4 to 6 years. So we're really just focused on the first dose here. And it's because between the ages of 14 to 18 months, there is an increased risk of fever-related seizures, most commonly actually due to infections, but rarely can also be caused by vaccines. And so the CDC had already been recommending, you have the choice, you can separate MMR from varicella, which is chickenpox, or you can get MMRV together. But they left it up to parents and pediatricians to decide what was best for them. That choice is now being taken away.
So what happens moving forward? And can these updated recommendations impact access to MMR and chickenpox vaccines?
Yeah, it's going to be a bit of a mess in terms of insurance coverage. So private insurance companies, AHIP, which is the organization that represents them, has said that they will continue to cover MMRV as well as MMR and varicella, so the combined or the separate. Okay. But then Medicaid won't cover the MMRV for kids under 4. But then state CHIP programs, which also covers young kids who are low income, they may or may not cover depending on the state. And then the Vaccines for Children program will cover MMRV. So it really is a bit of a mess. It's going to cause a lot of confusion.
COVID vaccines are also on the agenda. What can we expect on that topic?
Well, a few different things. I think we're going to see a narrowing of the indications, the eligibility criteria for COVID vaccines. The things that we're having to keep an eye on are infants. The American Academy of Pediatrics has recommended that infants 6 months to 2 years be vaccinated. Pregnant women, the American College of Obstetrics and Gynecology and the Society for Maternal Fetal Medicine have recommended that pregnant women be vaccinated. We know that's a high-risk period, but we may see that pulled back on. And we're also hearing the age at which vaccination is recommended has been 65 and over, may now be 75 and over.
All right, Gounder, thank you so much.
COVID is still a thing. I have a couple of friends that got it recently, and it really, they were down for the count with it. Yeah. Got to take it serious.